Hospitals around the country are short on staff, and in Idaho, that shortage is playing a large role in the activation of statewide crisis standards of care. Some major hospital systems have vaccine mandates in place for staff members. We wanted to know if these mandates have made the staff shortage worse and if those unwilling to get vaccinated have been fired. Our Andrew Bartline spoke with both St. Luke's and Saint Alphonsus today. And Andrew, rumors have been circulating that we're in crisis standards of care because of these mandates and that they've led to a large loss of staff in our hospitals. Is there any truth to that?
Yeah, keeping it really brief, Carolyn. No, it's not true. St. Luke's tell me they have not fired anyone for not complying with their mandate. And right now, the enforcement on the mandates has been paused at St. Luke's because they can't afford to lose staff. As for Saint Alphonsus, their deadline isn't until next week. Idaho is operating under statewide crisis standards of care, but have vaccine mandates in Idaho hospital systems created this problem?
Absolutely not.
We need to put this nonsense to bed.
St. Luke's and Saint Alphonsus say the opposite is true. Because we are in crisis standards of care, the two hospital systems are putting a pause on the enforcement of their vaccine mandates.
We literally cannot see the wisdom of even removing a single employee and making these already stretched teams work harder.
Both hospital systems say some staff members have resigned in response to the vaccine requirement. However, those numbers remain small. According to Saint Alphonsus, it's less than 0.5%.
We're incredibly pleased that people are responding to the scientific information and the correct facts and making the decision to get vaccinated.
So while enforcement of these vaccine requirements are on pause, both hospital systems say vaccination is an important measure to keep staff and patients safe. Because if a staff member gets sick from COVID themselves, that employee cannot go to work at the hospital and help others in need.
The number of colleagues that we have on quarantine right now is 3 times less than the number that we would have if we did not have a vaccinated workforce.
St. Alphonsus say they currently employ more people today than they ever have in the hospital's history. It's just another sign we're in a time of crisis, and these hospitals need all the resources they can get.
Are we changing our position on the requirement? Absolutely not. We're not. We're only saying this is a moment in time where taking those actions, it doesn't compute.
Now, St. Alphonsus' deadline for the vaccination requirement is next week, and they say they won't be enforcing that mandate while we're in crisis standards of care. It's also important to keep in mind Kootenai Health in North Idaho requested crisis standards of care more than a week before St. Luke's. I spoke with Kootenai Health this morning to confirm that their hospital system has no vaccination requirement, and they said that's true. So statewide, we're seeing no correlation between a vaccine mandate and a hospital system finding themselves overwhelmed.
Okay, well, thank you for diving into that for us.